So one of the solutions you've actually proposed is legislation at the federal level to actually address the physician shortage that exists right now in the country, especially in those underserved or rural areas. Can you tell me a little bit more of how that legislation will specifically address a number of those concerns that you brought up and how you see it passing in an already jam-packed legislative calendar?
Well, our nation has a very severe provider shortage crisis to begin with. There's some estimates that we need something like 20,000 more providers in our country. But on top of that crisis, there's another more targeted crisis in that there is a disparity or a mismatch of those physicians working in locations where they're needed most. There's a high concentration in very affluent urban areas, and there is a dearth or a severe shortage in underserved or more suburban or rural areas where you see more impoverished communities. So, for example, in my district, California's 36th district in Southern California, in the Coachella Valley, in the eastern side where I grew up in a farm worker community and the first few years of my life in a farm worker trailer park, we have one full-time equivalent physician for 9,000 residents. I did the research in 2009, and it hasn't gotten that much better. There's some improvement, but there's still a physician shortage. The recommended number in our country is one physician for 2,000 people. To be considered a medically underserved area, it's one physician for 3,500 people. So we are severely short on physicians. So there's two big efforts that I've been really pushing. One is I've been really augmenting the authorization and the funding for the teaching health centers. Those are the federal qualified health centers, community health centers that exist primarily in underserved areas, because if you create residency programs in those areas that serve those communities, primarily getting the residents who grew up in those areas, then they're more likely to stay and practice in those areas. So that's one effort that we've been successful in doing in the Energy and Commerce Committee, of which I'm a member of. The second effort is to expand the flexibility of hospitals that have residency programs in rural areas. So currently, they have about 5 years to develop their full set of residencies. And when you're in an under-resourced rural community as a hospital, it takes time for you to develop partnerships with universities. It takes time for you to raise the capital to hire more physician attendings that can train the medical students and the residencies. And it takes time for you to develop your general practice residencies and then your specialists like cardiology, neurology, or general surgery. And then on top of that, neurosurgery, cardiothoracic surgery, gastrointestinal surgery. And so my bill would provide certain criteria which would add the flexibility for those hospitals to have at least 10 years to be able to develop their full set of residency training. But we need to shift our thinking of just looking at the end stage of training to create more doctors and look at this in a pipeline form, and start really actively targeting and recruiting middle school and high school students and put them into pipelines that focus on fostering their interests, recruiting from underserved communities, then partnering with universities so they can enter as pre-med, go into medical school, then into residencies that they have training into the underserved areas. Because the two biggest predictors of where a physician is eventually going to practice are where they're from and where they last trained. And so I created a pipeline that's now housed under the University of California, Riverside, called Future Physician Leaders, where I recruited from underserved communities in my district. And it is a pipeline sponsored by UCR, where they have pre-med mentorship programs. They can go into residencies. And now we've developed residency programs in their communities. So the goal is that they will come back, serve as residents, and stay in those communities. And we need to amplify that, make that a program, a model program for the rest of the nation, so that we can really focus and targeted not only producing more doctors, but doctors that will serve where they're needed the most.